Hello, Facebook friends. It's Carla, your online doctor, with today's Live in 5. Today is Wednesday, April 10th at 5:05 p.m. Hope you guys are enjoying your week. Today is starting to get a little sunnier here in South Florida. Yesterday was kind of yuck with a lot of rain, very cloudy this morning, but right now we are thumbs up with the sun. So, we are talking, hello Teresa honey, we have been talking about screening tests this week and last week. And today, let's discuss eye screening. Okay, there is a difference between simple vision screening and a comprehensive eye exam. A vision screening is a relatively short exam, maybe about 10 minutes, where they basically just check your vision, maybe check for color blindness. Okay, it can indicate that there's a problem or a potential problem. This can be done by your primary health care provider. And in children, they do them in schools. It really can be done by anybody. It's not really hard to do. But they're checking for things like amblyopia, lazy eye, which presents as blurry or reduced vision in one eye. They check for strabismus, also known as crossed eyes. Vision screening also checks for nearsightedness, which is called myopia, where far away is blurry. Hey, Roy, how are you, honey? So you can see close, but you can't see far. And then they check for farsightedness, which is called hyperopia, which close-up things are blurry. Okay, so you can see far away, but you can't see close. Hello, Cecilia, babe. And then they also check for what's called astigmatism, where both close and far things are blurry. Okay, now the American Academy of Ophthalmology recommends screening in children every year, and only as needed in healthy adults. Okay, and that is really just a vision screening. And the reason why you check in children often is because they are growing, the muscles in the eyes are growing, the head is growing, everything is growing, and things can change more rapidly. Obviously, in adults, that doesn't happen because we are full grown, but there are changes that can happen as we age. Now, a comprehensive eye exam is recommended at age 40 as a baseline, since this is when early signs of disease or changes in vision may appear. Now, early treatment can help preserve your vision. Some people should get this done earlier than 40 years of age, obviously. If you have an eye disease or a problem that you've had since childhood, then this is something you should be following up on, okay? So that is probably not news to you. But if you have diabetes or high blood pressure or a family history of an eye disease, you should probably be getting checked before the age of 40. Now, the ophthalmologist will tell you how often you should follow up in the future, depending on the findings at your baseline exam. Now, once you reach age 65, you should get a comprehensive eye exam every 1 to 2 years, looking for age-related eye diseases, including cataracts, diabetic retinopathy, age-related macular degeneration, and glaucoma. Okay, those are very important for you to follow up on because it can affect your vision for the long term. Okay, now during a comprehensive exam, they will check mainly for things that the vision screening, more than the vision screening, okay? Because the vision screening is just the baseline. So expect it to take about 45 minutes to an hour. Now, your vision will be checked, and depending on the results, they may use other machines to allow the doctor to determine your need for corrective lenses or glasses. Okay, I don't know if you've ever done it, but they put these things in. Is your vision better? Is it worse? And they're going to determine which type of vision you have and how corrective lenses, again, whether they be contact lenses or glasses, will help you. Now, most likely they will also dilate your pupils with drops, so come prepared with sunglasses or someone to drive you home, because this can affect your vision for a short time afterwards. Okay, if you live someplace like South Florida where it's super sunny, once those pupils are open and they're chemically opened, they won't constrict when the sun hits them because the drugs are making them stay open. So you need to wear sunglasses to prevent that severe amount of light coming in and affecting your eyes. Now, the doctor will check your pupils. They'll check for eye movement, peripheral vision, as well as your eye pressure, since elevated intraocular pressure is a sign of glaucoma. Now, since they actually touch the eyeball with a machine, I know it sounds kind of gross, but they may actually apply a topical anesthetic eye drop as well, which makes your eyes feel kind of weird. Now, using a special microscope, they will check the front of your eye, including the cornea, the iris, and the lens, and then the back of the eye using an ophthalmoscope, which is that one they get real close to you and you feel like you're about to kiss your doctor, but they're actually looking at the back of your eye. They're looking at the retina and the optic nerve. Now, other specific tests may be done, but are on an individual need. So a comprehensive exam will cover all of that, and then based on if they find anything additional, may require other things. So again, these are things that need to be done. You need to get them done. So consider if you're otherwise healthy, age 40, and then again at 65, those are like the buzz years. And then if there's any problems whatsoever along the way, if your glasses, if you have prescription lenses and you see that your vision isn't as good as it was, get your eyes checked, okay? Because you only have two eyes and we don't, there's no forgiving. Once something happens, a lot of times damage can be permanent. And that's not to scare you, that's to keep you informed so that you go and get these things checked. So I hope you guys are having an awesome day. I hope you were liking this whole series this last week or two of the screening tests, which I encourage people to get. So I will be back tomorrow for more screening information. So you guys have an awesome day, and I'll see you again tomorrow for another Live in 5.